And I call Jamie Greene to be followed by Alison Johnson.
Thank you. It sounds, listening to the speeches today, that Sandra White and her colleagues in those benches really like facts. So here are some facts. Shortfalls in GPs, consultancy vacancies up, nursing vacancies up, agency uses up. The problem is, presiding officers, that these are facts that they don't like and are facts that they don't want to listen to. I'd like to talk today about what really matters in this debate, and that is people. And the people involved in this complex, ever-growing and ever-demanding system are the ones really affected by the decisions that we make in this Parliament, but also decisions made in the health authorities which manage these services. Now, these people are patients. These people are also nurses, doctors, GPs, consultants and locums, and they themselves paint a picture of the NHS in Scotland today. Now, I'll focus much of my speech on the area that I represent, the west of Scotland, because these are people that write to me and tell me their frustrations and their woes and their battles. And before we look at the areas where there is much work to be done, it is entirely right and appropriate that we pay tribute to the staff who work across the NHS, for often, as we stand here and debate the bigger picture, it is they who are looking after our friends and parents, sons and daughters, neighbours and colleagues. Now, my region is primarily looked after and covered by NHS Greater Glasgow and Clyde and NHS Ayrshire and Arran. And I am deeply troubled by many of the statistics that I read. I'm deeply troubled by the stories that I hear from the people who have contacted me in my short time as an MSP in this place. I have three areas of concern. The first, waiting times and targets. NHS Ayrshire and Arran has seen psychological therapy waiting times sitting at 73%, where the target is 90%. 73% where the target is 90%. What does this actually mean? It's not just a number. These are people who are waiting to see someone, a specialist, for things like CBT or talking therapies. These are people who may be suffering from depression or addiction. The overall 18-week referral to treatment target is 90%. It's currently being met at just 74%. And in Inverclyde, one constituency contacted me a few weeks ago to say that she was told of a 3-month wait for a mammogram after telling her doctor that she'd discovered an unusual lump. 3 months of worry and distress. Now, after persistent daily phone calls to Inverclyde Royal Hospital, she managed to bring that forward. But it shouldn't have to be he who shouts the loudest gets an appointment. My second area of concern is vacancies. The vacancy rate in North Ayrshire and Arran is double the Scottish average at 16%. Now, yesterday as I walked to this chamber, I chatted with the people from Parkinson's charity, standing just metres away from here, and they told me that in Ayrshire there was just one single Parkinson's consultant, and there should be 3. I was told about people who had been waiting 18 months for an appointment. The vacancy rate in that same health board is as follows for consultants: 25% for cardiology, 50% for orthodontics, 22% for child and adolescent psychiatry specialists, and a staggering 35% for geriatric specialists. And these are very, very high numbers in terms of vacancies. I accept that these are specialist areas and that recruitment can be difficult in certain parts of Scotland, but more must and ought be done. It is clear that a culture of poor I'd like to make some progress, please. It's clear that a culture of poor workforce planning is contributing to this bill, and it is not just an occasional requirement, as the Cabinet Secretary said in her opening statement. The third really important area I'd like to mention today is that of well-being in the west of Scotland. Now, the 2015 Scottish Health Survey released yesterday showed that really pitiful progress has been made on this. 2/3 of Scots are classed as overweight, with 28% classed as obese. Very little has changed in 7 years. That same survey said that 21% of Scottish adults smoke, whilst it is 17% in England. 1/4 of Scots are classed as drinking to harmful or hazardous levels. Alcohol-related morbidity has increased. It showed in the new Scottish Index of Multiple Deprivation data that in my area, Greenock and Paisley are areas which have been consistently among the 5% most deprived in Scotland since 2004. So what has the SNP government done to tackle this after 9 years? Well, as we pointed out yesterday, the Scottish Conservatives said that areas across Scotland have seen very little improvement in well-being. And not only that, but we have a First Minister who, as Health Secretary, made decisions that result in this crisis, but still refuses to take personal responsibility for the very issues we're standing here discussing today. There's a £60 million black hole in the funding for NHS Greater Glasgow and Clyde. There's a £30 million black hole in the funding for NHS Ayrshire and Arran. Both of these health authorities have major ongoing problems with delayed discharge. Thousands of days of bed days are lost each month. So whilst this debate, in conclusion, will focus on the politics and the policy of the NHS, I sincerely hope that it is the voices of the people of Scotland who are suffering at the hands of, after nearly a decade of the SNP in power, that we listen to those voices the most.